morning. We'll call the Health Department Committee to order. This is June 2nd, 2020 at 9 a.m. And would you please call the roll?
Whitlow?
Here.
Curtis?
Here.
Barr?
Here.
Awful?
Here. And I have a motion to approve the agenda.
So moved.
Okay, and a second.
Second.
Motion carried. All in favor?
Aye.
Opposed? Okay, let's look over the claims for the animal control.
Good morning.
We're working on the claims right now.
Are they?
You sit up over there in the far front and the far right.
Oh, okay. Thank you.
Roger, are you ready to move on? Are you ready to move on?
Yeah.
May I have a motion to approve the claims?
So moved.
Okay, second? Ernie, second. Do we have any discussions, questions? Dr. Yusuf's not here to answer them. Okay, we can take roll, please.
Whitlow?
Yes.
Curtis?
Yes.
Barr?
Yes.
Doobie?
Yes.
Apple?
Yes. Any public comments? No. And Dr. Yusuf's not here for a report today, so we will now hear from Dee Shippert from the Health Department.
Good morning.
Morning.
I did not bring a grants and contracts list for you because we're still working on that, but I do want the health committee to know that we have already brought in about somewhere in the neighborhood of between $68,000–$70,000 in new grants. During the time that we have been focusing on COVID, we did get a CARES Act grant. It was around $1,400. We got a grant from the Community Foundation, which is the Kankakee Iroquois Iroquois Valley Community Foundation. They gave us $8,000 to help with COVID expenses. And then the Illinois Department of Public Health gave us a $41,000 grant, a COVID crisis grant that came from the state. And then we received another small grant as well. So the senior services grant, and that one was for about $17,000. So we have that. We also have another grant that I'll be submitting by Friday of this week. It's a substantial grant. We'll see what happens with that. But the funding has been available at least to help with additional expenses that go along with all this COVID disease investigation and contact tracing. We have had 132 cases of COVID in positive laboratory confirmed cases of COVID so far that have been reported to the health department. As of yesterday, we had received 1,284 test results. 1,152 of them were negative and 132 have been positive. Of those 132 individuals, 95 have recovered and have been released from isolation. 3 remain hospitalized, 30 remain isolated at home, and 4 have passed away. One of the things I keep pointing out, that I think is important to keep pointing out, and since this is publicly recorded, I think that this is an important point to make. The health department isolates those individuals who test positive and are laboratory confirmed cases, not just a doctor's diagnosis or someone thinking that they have it. Those are all laboratory confirmed cases, and those are the cases that we place into isolation, mandatory health department isolation. They're isolated for a minimum of 10 days. And then they have to meet very specific criteria to be released from isolation so that they can return to their normal activities of daily living. We quarantine all the contacts of those cases. So of the 132 cases we've had somewhere in the neighborhood, I think right around 500 people who have been placed into quarantine, and that's quite a bit. Now, depending on, the quarantine minimum is a minimum of 14 days, but it's 14 days from their last exposure. So if it's a household contact, someone who lives in the house with them, their contact with the case continues until the case is released. Once the case is released, after a minimum of 10 days, plus other criteria, then their 14-day quarantine period starts, because quarantine starts from your date of last exposure. Does that make sense? So some of those people are in quarantine for 24 days or longer. That's a long time to be in quarantine. We have been very fortunate, extremely fortunate in Iroquois County. Almost all of them have been very cooperative. They have voluntarily complied with isolation or quarantine measures. They are cooperative with the daily monitoring, because they're called every day. Depending on how they're doing, we may not call them on the weekends if they're doing okay. But if it's somebody that we're worried about, then we call them on the weekends as well. If you look back at some of our press releases, our daily press releases, you'll notice that there's a pattern of getting more cases usually on the weekends than during the week. A lot of people are tested Thursday or Friday, and then those test results come to us Saturday or Sunday. So our weekends have been extremely busy. But as far as the people that are in quarantine and isolation, they have been very cooperative. They call and ask questions. We are responsible. Once we place someone into quarantine or isolation and we ask them to remain at home, they are only allowed to leave home to seek medical attention. They're not allowed to go to work or to go out anywhere in public. So we have the responsibility of making sure that their needs are met while they're in quarantine. So a lot of the grant funding that we've gotten has been used to help people with groceries, because they can't go out and get their own groceries. And some of them have family members, but the family members are afraid to bring them groceries too. So we get a grocery list. We shop for them. We drop the groceries off at their doorstep. We provide them with thermometers, whatever else that they need in order to remain compliant to keep the rest of the public safe. And we've been extremely lucky. We really only had one family that was not cooperative, and Jim Devine helped me with that, and they became cooperative. We have not had to seek a court order to keep someone in isolation or quarantine at this time, not for COVID anyway. And that's a good thing, because you don't want to have to do that if you don't have to. But most people are very considerate. They don't want to spread this illness to other people. They don't want to make other people sick. They care for their neighbors. They care for their community. I think that speaks volume for the community we live in, because I can tell you across the state, a lot of health department administrators are having terrible times keeping people who tested positive in isolation. And we haven't had that issue in Iroquois County. I really do think that speaks volumes about how our community cares for each other. I think that's a good thing. And there's a lot of benefits to living in rural Illinois. We still have senior service grant funds available to help people who are 60 and older with any of their needs. A lot of people who are 60 or older have a possibility of having a chronic health condition that would put them at higher risk. So to protect our vulnerable population, the Illinois Department of Aging gave us the senior service emergency grant so that we can go out and get their groceries for them and take care of them. So we still have those funds available. There are still funds available from that grant. So if you know anyone that's 60 or older and could use a little help and doesn't want to have to risk going, into a big store to go shopping, let us know. And we have grant funds available to help them. That's what that money's for, so. That's just kind of a very general overview. Do you have any specific questions? I'll answer anything you want to ask about COVID.
What about the other members of their family?
So the
That's living-
house,
That's living in the same house.
right, so, those people that are living in the house are quarantined as well, you know, so the person who tests positive is isolated, their family members are quarantined. Some of them get sick and some of them don't. If they get sick, then we transfer them from, they're never counted as one of our cases, okay, as our positive cases, unless they test positive. But we transfer them internally from quarantine to isolation if they become sick, and then they have to meet the isolation guidelines. But that's why we do the daily monitoring. There are quite a few family members who get sick, more than people think. So when people look at our numbers and think there's only 132 cases in Iroquois County, that is certainly not true. We know that a lot of their household contacts and workplace contacts and social contacts have gotten it from them and are ill too. We don't necessarily encourage them to go get tested. If their illness is mild enough to stay home, you know, even if they're running a fever, have a cough, have a sore throat, you know, if they don't need to seek medical attention, we don't ask them to go be tested because we know what they have. And we don't ask them to go be tested for two reasons. Well, actually three, but the main two are, we don't want, if they're sick, they don't feel good. And we don't want sick people leaving their homes. We don't want them to go to the hospitals or the doctor's office and infect the healthcare workers unnecessarily. We also, there is not an abundance of testing supplies. Still, we don't have an abundance of testing supplies. So why waste testing supplies on somebody you already know what they have? You already know, you know, if they're living with, you know, somebody who tested positive and they have the same symptoms, and we know what they have. So we don't ask them to go be tested. Now, if I took everybody that got sick that's in quarantine and swabbed them all and did a PCR test on them, we'd have our number would definitely be triple what it is. It really would. But we haven't been asking them to leave their home. We want them to stay at home if they're ill, seek medical attention if they need it, but otherwise stay home. And then we release them once they meet the specific criteria for releasing them. But yeah, a lot of them do get sick. We also have ones that are completely asymptomatic. We have people who tested positive that are asymptomatic and only found out that they were positive because they had to get a test because their workplace required it, or because they were going to have an elective surgery and it's required before surgery. And sometimes these people are shocked that they test positive. And but they're placed into isolation, their family members are placed into quarantine, and that's where you get people who are not happy about this situation because they're asymptomatic and they feel fine. You have to remember early on, when we first started testing for COVID, the testing was only done on hospitalized people initially. Then it became available for people who were ill. So you had to have signs and symptoms to be tested. Then it became available for specific workplaces, healthcare workers and what they consider critical infrastructure workers and all those things. And then it became available to the general population. So at the beginning, all the people who were tested were sick. So the numbers that we had, the first, 30, 40 cases we had, those people were sick. Now we see people who are asymptomatic. The first 30 days that we were in quarantine, I hate that word, quarantine, because you isolate, you're ill, you're quarantined, you're exposed. Everybody else was under a stay-at-home order, right? Which is something totally different than isolation or quarantine. Even though people say we're in quarantine, and sometimes I even catch myself doing it. But the first 30 days that we were under the gubernatorial stay-at-home order, we were not sure what we were going to see. we were not sure what our numbers were gonna look like. I think it worked. I honestly think that had we not taken the measures that we took for the first 30 days, we would have seen a lot more people that became ill. And we would have seen a much bigger, widespread spread of the disease. But now what we're seeing is people who are not quite as ill. We do know that sometimes viruses, as they pass from person to person, become weaker. And we hope that's what we're seeing. Now, we'll get a second wave there. You almost always get a second wave. Someone asked me the other day when I predicted the second wave, and I said, I don't know, I'm not even 100% sure we're not in our second wave now. You know, this could have been around a lot longer than we thought. And we don't know that. But at some point in the fall, we'll see another surge. That happens with every single known virus. You always get, waves. But hopefully those people in the fall won't be near as ill because the virus has gotten weaker. And hopefully we won't see a lot of viral mutations where we're seeing different strands. Hopefully we'll have some immunity build up in the community, which is a good thing. But only time is going to tell. Yeah, go ahead.
I was at Watsika yesterday, and one of the people working there said that it was not a virus, that it's a bacteria. What do you say to people that think it's bacterial?
They don't know what you're talking about. This is not bacterial. If it were bacterial, everybody could take an antibiotic and that would kill the bacteria, and then nobody would have to worry about anything. We could mass prophylax the general population with an antibiotic if this were a bacterial disease, and everybody would be fine. But we can't do that because it's a virus.
That's why I wanted to bring it up. So,
people are misinformed. And I read stuff on Facebook all the time, and I'm just like the rest of you. I look at it and I think, I can't even go there. I can't even address that. Lots of myths, lots of misinformation.
There's a good chance all these protests igniting something though, I think.
Oh, well, we know that coronavirus is out there in the community, okay? Because you can test people and find it, right? So yeah, all these protests where people are not wearing masks, you're going to see a surge. Give it the 14-day incubation period, and in 2-3 weeks from now, those cities are going to see some surges. How bad it is, I don't know, but we'll see some. I mean, I don't see how you can not, but will it be as bad as
Hope not.
yeah, I hope not too. I hope not.
It's spread pretty well throughout the county, or are there any
Hot pockets.
spots?
Yeah, well, I'll be honest with you, we have almost every zip code in the county. We have 24 zip codes in this county, and I think almost every zip code has at least one case now.
Yeah.
So it's spread throughout. But, initially, we didn't publish the zip codes because, according to state statute, we have to follow IDPH guidelines. And IDPH releases that, but they only release that once you hit 6. Okay, once you hit 6 cases in a zip code, then they release it on the zip code finder. Which is that link to that zip code finder is in every press release we send out. But I can tell you early on, way before that anything showed up on there, they were scattered throughout the county. There was not a rhyme or reason. It was really and truly interesting. We mapped it every day. Eric Stacy likes maps, and as my public health emergency preparedness coordinator, he'd make me map every day and add the cases. And I'm not kidding you. They were scattered throughout our little square county, which I should say our big square county, because we're the 3rd largest land mass county in the state of Illinois as far as land mass goes. But yeah, it was spread out everywhere. And most of the cases that we saw in the beginning had no ties to the other cases. So when you contact trace them, we couldn't find any linkage. You know, then as time went on, now you find linkage because household members are getting sick and, you know, so forth.
I heard that Merkel Nipratt had 32 cases.
That's not correct.
Yeah.
Because some of those are not, yeah, they may have had, we may have had that many cases tied to them, but that doesn't mean they had those cases inside the building. Because some of the cases that they had were staff, some were residents, some were people who had made deliveries, you know, there's all kinds of different things. But yeah, they had a significant amount, and it's not a secret. But not all the cases were residents only. We've had 5 outbreaks. So if you look at I went ahead and gave you this today, just so that you have it, your program summary report, although you can see that most of our efforts have been focused on COVID. So if you start off with environmental health, you'll see that they really haven't been doing any regular inspections, okay? What their focus has been on is on the complaints. Now the COVID complaints, we didn't add a list to that. Those roll in by the dozens every day. And here's how the health department decided to handle the COVID complaints. Because you always get people calling in and says, you know, I went into this store and I saw people in there without masks. I went into this store and I saw an employee without a mask. I went into this store and they didn't have any, they were out of hand sanitizer. I went into this store and this, you know, complaints, constant, all day long. We didn't even tally those numbers. And we've gotten to the point where now we're only taking complaints if somebody's willing to make a formal complaint, which means they'll put their name with it. We explain to them, if you make a complaint and your name is with that complaint, it is FOIA-able. You know, so that company owner can contact the health department and request a copy of the complaint, and they will receive it. So, you know, because we're not taking anonymous complaints anymore, because so many of the anonymous complaints were running our staff to death, and we get there and half of them weren't even true, you know. So we decided that we would try to have a little bit of control over whether the complaints were legitimate or not, and that was the way to do it. But if someone makes a complaint, you know, we always investigate the complaints. So that's what the environmental health staff have been doing. Obviously, the nursing staff have been doing disease investigations. Each one of those positive cases has to go into INEDS. Each one of their contacts also goes into INEDS, but goes into a different system called REDCap. REDCap's a nightmare, so we've been using spreadsheets. The state is making a new contact tracing system. That'll be up and running here very shortly. You hear a lot about contact tracing. And the grant that I was telling you that I'll be writing and submitting by Friday is a contact tracing grant, and it's a significant amount of money to do thorough contact tracing. Some counties in the state have not had enough staff to do thorough contact tracing. They just don't have enough staff. And there aren't enough hours in the day, you know. Let's say at any given moment you have 300 people that are in quarantine. That's 300 phone calls a day, you know. That's a lot. That takes a lot of staff to do those phone calls. So some counties can't, you know, that number was for us, you know. Some counties, you know, look at take Key County for just as an example. They're up to almost 1,000 cases. And I don't even know if they're over that now. But let's just say some of their contacts, some of their cases, their positive cases had 5 contacts, and some of them had 20. You know, you multiply that number by the lowest number, or 5, there's 5,000 people that they're contacting every day. You don't have enough staff to do that. Most counties don't. So they choose the highest risk ones and focus on those. But this contact tracing grant that's coming out is going to provide funding for health departments to get additional staff to do that. Obviously, our problem with additional isn't that we won't have the money to pay them, because with this grant we can pay additional staff. We don't have a place to put them. So that's our concern right now, is where do we put them? Everybody's so, we have to put desks out in the hallway. You know, we don't know what else we're gonna do at this point. I'll be talking to John about that later, but the contact tracing, if you want to do a really thorough job and do a really good job preventing the spread in your community and keeping your vulnerable populations safe, you have to do thorough contact tracing.
Will those be temporary jobs then?
Yep, this contact tracing grant will run from June 1st, which is today, even though the grant just came out last week, and it's not even due to be submitted until Friday. It'll start June 1st, which is yesterday, I guess, and it runs through May 31st of next year. Because COVID is not going to go away, we know that, and eventually many people will get it, and we'll be doing a lot of contact tracing over the next year, a lot of contact tracing. So that'll take a significant portion of time. And my nurses still have their other jobs. They still have to do immunizations and the breast and cervical program and the lead program and the hypertension program and you know, TB skin testing programs and, you know, all their other things. So yeah, we're gonna have to hire some additional staff.
Yeah, you don't want burnout.
Oh no. Well, I will say this, my staff's pretty wonderful, and if you don't already know that, you probably would be impressed. Some of my nurses are putting in 16-hour days and have done that for 10 weeks straight, literally 16-hour days. And that includes the weekends as well. They worked, you know, Easter, we worked Mother's Day, we worked, my first day off in like 70 days was, well, more than that actually, it was probably closer to 100 days, was Memorial Day, and I finally just shut my phone off. I didn't even answer phone calls that day. I just needed a break so bad. But the nurses really are putting in that many hours. And not just the nurses, some, you know, I have other staff doing overtime as well. But this week it has slowed down. You notice that the last 4 or 5 days, we've only had a few cases. It's been a tremendous relief for them to be able to go home at 5 or 6 at night instead of 9 or 10 at night. It's been a relief.
I think you started to say, but what constitutes an outbreak?
Okay, oh yeah, thanks. So an outbreak, yeah, you know me, I get off all night.
Well, that's okay, but I remember that.
So an outbreak is, it depends on the facility. So if it's a long-term care facility, 2 or more cases is an outbreak, okay? If it's a congregate setting facility, maybe not a long-term care, but a congregate setting where people are all, you know, together all for extended days, 2 or more cases is an outbreak. And then so we've had outbreaks in 2 long-term, out of the 5, you'll see those, the 5 that are total, those are unduplicated counts. So even if they're still under an outbreak, we don't count them again the next month, okay? We only count them on the month that the outbreak begins. So those numbers that you see, that they're unduplicated numbers. But our outbreaks, we've had 2 in long-term care facilities, 1 in a congregate setting, and then we've had 2 in businesses that were related to a specific workplace. And we've been so fortunate because the workplaces, the long-term care facilities, obviously, these people are just busting their tails to do whatever they can to prevent this. You know, you heard me say that in a press conference not too long ago. You know, it's easy for people to say, well, these long-term care facilities that have all these people, you know, must not be taking good care of them. That's not it. It's not that they're not taking good care of them. This virus is so tiny and spreads so easily, and that we've been preaching that from day one. This spreads so, you know, people keep calling this up, this is just like a flu virus. Oh no, it's not. Typical flu virus doesn't spread near as easy as a coronavirus. Coronaviruses are much more likely to spread. Even if you're super, super careful, even if you wash your hands, you know, even if you're gowning and masking, there may be some part of your body that wasn't covered or something that, where you can transmit this virus. It's so easy to do, even if you're taking almost every single step you can. Some of these congregate settings, it's gonna happen, but I can tell you that the long-term care facilities in Iroquois County, those people have gone above and beyond. You can't even imagine the leaks they have gone through to take care of their residents. People don't work in long-term care to get rich. The nurses and the CNAs that work in these nursing homes do it because they love their residents, and they're doing their best. They're reaching out to Eric. He's been delivering masks and gowns and gloves and face shields and thermometers and all kinds of things to them. We've had numerous drops from the Strategic National Stockpile through Public Health Emergency Preparedness and through EMA. And we have lots of supplies and as soon as we get them, there are people waiting on them. They want to take good care of their residents. And the businesses that have had an outbreak, the business management and owners have been extremely cooperative with us. We've given them a ton of guidelines and suggestions and asked them to do a lot. We've asked them to jump through a lot of hoops, and they've willingly done it to try to protect their staff as well as their customers. They've done everything we've asked of them, and we've been very fortunate. That doesn't happen everywhere. I'm on administrators' calls every day, and we've been very fortunate in Iroquois County because we do have a community that cares about each other. That doesn't happen everywhere, people. We're lucky. Any other questions about coronavirus? I may not have all the answers, but I'll try to find the answer for you. Try to find you an accurate one. But please don't believe all the stuff you read on Facebook.
What? It's not true?
It's not. And I say that not to you guys, but because we're recorded and I know that the public views it.
That's why
So.
I brought up that one question.
Yeah, it's just, yeah.
What do you think's gonna happen to the schools this year?
I believe, if you're asking for my opinion, obviously I don't have a crystal ball and I can't give you all the answers. It's going to depend on what happens over the next few months. But I believe that there will be school in the fall.
If there will be?
I think that there will be.
What'd you say? I'm sorry.
I think there will be
What?
school
Oh,
in the fall. My daughter is going to attend Millikan University, and she got a letter the other day, and they are going to have fall in classes, but they're postponing them now until after Labor Day. So I think that, each school district will have a school board that decides for them what's right for their district and go from there. Hopefully by the time school starts, we're in phase 5 and everything, can kind of go back to normal. I'm hoping anyway. My diligent hope. Any other questions? Thank you.
thank you, Dee, for your report. Okay, do we have any old business today? New business? We have a motion to adjourn.
So made.
Second? All in favor, say aye.
Aye.
Opposed? Adjourned.
What was that